A runner would come to a doctor for prolotherapy because often physical therapy and exercise modification doesn't eliminate the shin splints. And shin splints specifically are pain originating in the shin where certain muscles attach. It's also called periostitis, meaning that the bone where the muscles attach is inflamed or irritated. And sometimes even if a runner stops running, tries physical therapy, exercise modification, the pain doesn't go away once they start running again. So prolotherapy specifically would strengthen the muscle attachment to the bone, whether it's the posterior tibialis muscle or some other muscle, and it's very effective at getting a runner back quickly. So there's many reasons why a runner would consider getting prolotherapy for shin splints. One is that the other treatments they're trying isn't working. Two is they want to get back quicker. Three is it's very cost effective. I mean, prolotherapy for the shin costs about the same as one session of physical therapy. So in many respects, prolotherapy is a very cost effective treatment because it generally you only need 1 or 2 visits, especially if a runner just got shin splints. So I would consider shin splints as one of the primary ways, I would consider prolotherapy one of the primary ways that a runner with shin splints should get treated. A runner who gets prolotherapy for shin splints typically has certain exercise modifications initially. For instance, they receive prolotherapy, say, on a Monday, then typically they could start exercising the next day. There's generally a progression where first they would try non-running exercises such as bicycle riding, swimming, or running in the deep end of a pool. And then after 2 or 3 days, if that worked out fine, then we would do some treadmill or soft surface running, but very slow, and then build the runner's endurance, meaning that they would do more and more of that kind of slow running. And then once they were up to, say, a half an hour of running slowly on a treadmill or a soft surface, then we would try some more fast running. But typically, within a few weeks, the runner is back to running. Now, there are cases, of course, where it's a very chronic case. It's a very chronic case of shin splints, and the runner has all different kinds of other medical conditions, health issues, healing issues. So sometimes more than one visit of prolotherapy is needed, especially for more chronic cases where there's other things going on. So a runner can get prolotherapy up to every couple weeks, if needed. So sometimes, 3, 4, 5 visits are needed. So in that scenario, it may take 2, 3 months to get back to running. But if a runner just decides initially they have shin splints and they want to get prolotherapy instead of other traditional treatments, then in my experience, the runner is just going to get back to running a lot more quickly.